Hello and welcome. Let's talk about Acute Suppurative Otitis Media or simply ASOM. So what is it meant by Acute Suppurative Otitis Media? It is an acute inflammation of the middle ear by pathogenic organisms. Here, middle ear implies middle ear cleft, that is eustachian tube, middle ear, attic, editors, antrum and mastoid cells. Etiology. It is more common especially in infants and children of the lower socioeconomic group. Typically, the disease follows viral infection of the upper respiratory tract, but soon the pathogenic organisms invade the middle ear. Routes of infection: eustachian tube, external ear, and blood bone. Predisposing factors: recurrent attacks of the common cold, upper respiratory tract infections, and exanthematous fevers like measles, diphtheria, or whooping cough. Infection of tonsils and adenoids, chronic rhinitis and sinusitis, and nasal allergy and cleft palate. Now, bacteriology: Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Other includes Streptococcus pyogenes, Staphylococcus aureus, and sometimes Pseudomonas aeruginosa. Pathology and clinical features. Now, during the stage of the tubal occlusion, there may be deafness and earache but no fever. Tympanic membrane is retracted with handle of the malleus assuming a more horizontal position, prominence of lateral process of malleus and loss of latiflex. Tuning fork shows conductive deafness. And during stage of the presuppuration, there is marked earache which may disturb sleep and is of throbbing nature. Deafness and tinnitus present, and child runs high degree of the fever and is restless. The congestion of the pars tensa is seen and the list of blood vessels appearing along the handle of the malleus and at the periphery of the tympanic membrane, impacting a cartwheel appearance is seen. Tuning fork test shows conductive type of hearing loss. And during the stage of the suppuration, the earache becomes excruciating and deafness increases, and the child may run fever of the 102 to 103 degree Fahrenheit. Tympanic membrane appears red and bulging with loss of landmarks, and the handle of the malleus may be engulfed by the swollen and protruding tympanic membrane and may not be discernible. A yellow spot may be seen on the tympanic membrane where rupture is imminent. X-ray of the mastoid will show clouding of the air cells because of the accident. During the stage of the resolution, the earache is revealed with evacuation of the pus and fever comes down and the child feels better. External auditory canal may contain blood tinged discharge which later becomes mucopurulent. Usually a small perforation is seen in the anterior inferior quadrant of the pars tensa, and hyperemia of the tympanic membrane begins to subside with return to the normal color and landmarks. Now, stage of complication. When resolution doesn't take place and the disease spreads beyond the confines of the middle ear, complication may arise, which may lead to acute mastoiditis, supraparietal abscess, facial paralysis, labyrinthitis, petrositis, and others. Treatment: antibacterial includes ampicillin, amoxicillin, and others. Decongestant nasal drops may be given. Oral nasal decongestant may be given. Analgesics and antipyretics can be given. Ear toileting should be done if there is discharge in the ear. Dry local heat for relieving the pain, and myringotomy is done when the drum is bulging and there is acute pain, when there is incomplete resolution despite antibiotics, and when there is persistent effusion beyond 12 weeks. End of the topic.